In this Introduction to Gynecologic Cancer lecture, what I want to do is present the different diseases you're going to see in the upcoming lectures with an overview of the different cancers, but more importantly, give you an approach to how you handle the development of malignancy, as well as keeping track of which cancers and risk factors occur in which age group. Let's start off with how cancer develops. Some etiology, some risk factor, some exposure occurs. And over time, that exposure predisposes normal tissue to turn into pre-cancer. And if left unopposed long enough, it will develop full-blown malignancy, cancer. This process takes a variable amount of time depending on the cancer and depending on the exposure. But generally, it is in the order of years to decades after the exposure to development of the cancer. And obviously, the longer you're exposed to the particular etiology, the more likely you are to flip the switch into precancer. The etiologies we're going to consider are going to be things like toxins, viruses, estrogen, and for ovarian cancer, ovulation. Now, these risk factors then give rise to precancer, which comes in the form of carcinoma in situ or some dysplastic tissue. Cancer just doesn't come out of the blue. Normal tissue has to flip the switch and go into a malignant pathway. And if allowed to go on long enough, you'll get malignancy. And the malignancies you're going to see the most are adenocarcinomas and sarcomas. Now, your job as a physician changes depending where they are in the process. If you're at the etiology phase, your goal is to identify risk factors and try to reduce those risk factors or even simply prevent them, as in the case of vaccine against a virus. Once you get into the pre-cancer phase, if you find pre-cancer, resection at this point is curative. In order to find precancer, then, we'd have to start doing screening. If you get to the cancer phase, and this is where you find it, your only job is going to be diagnosis and staging. And based on the staging, surgery, generally in the form of debulking, radiation, and chemo. You're actively treating the cancer, but ideally you'd prevent it or capture it before they became full-blown cancer. And obviously, the worse the stage, the worse the prognosis. This is the method for how cancer develops. You'll also need to be able to identify the risk factors and the malignancies by age group. In this advanced organizer, you'll see throughout the gynecology course. This line represents the lifespan of a woman. At 11, she undergoes menarche and begins having menses. At 51, menopause, and her cycles stop. This divides her into 3 age brackets. The premenarchal girl, the postmenopausal female, and the reproductive age woman. Based on the age, the exposures are going to change. For example, in the premenarchal girl who has yet to have menses, she has no estrogen. Her ovaries have not turned on yet, and likewise has had no ovulation. Girls less than 11 years old usually are not sexually active and so have not been exposed to viruses. But at this age group, toxins become really important, especially those toxins that mom was exposed to while baby was in utero, and now as a child, she's feeling the results of these toxins. But once a girl hits menarche, begins having periods, now she's beginning to produce estrogen. She's beginning to have ovulations. With sexual activity comes exposure to viruses. But generally, there's not a whole lot of toxins that come up that are going to be malignant other than smoking. And even though the postmenopausal female no longer has periods, she has had a lifetime of exposure to estrogen and to ovulation. So not surprisingly, the postmenopausal female is going to be the one who has the most malignancies, because any of the etiologies, any of the risk factors had occurred for her entire life, and now she has the greatest chance of developing the cancers. Etiology to cancer, exposure by age bracket. Let's talk about the structures you might encounter. This is a uterus, fallopian tubes, ovary, fallopian tubes, ovary, vagina, vulva. Ovarian cancer is the most complicated because it consists of 3 different cell types. You could have germ cell tumors, stromal cell tumors, or epithelial cell. We talk more about this in the ovarian cancer lecture. The endometrium of the uterus can become malignant, and you can get endometrial adenocarcinoma. The cervix is where the uterus meets the vagina, and you can get cervical cancer that's either ectocervical, visible to the naked eye, or endocervical, still part of the cervix, but not visible by simple inspection. Cervical cancer is almost always squamous cell carcinoma. Vaginal cancer is also likely to be squamous cell carcinoma, and so too is vulvar cancer. There is a variant of vulvar cancer, which is called Paget's disease, which will be a red lesion. And you notice what I did there. This is color-coded. The ovarian tumors are of different cell types than endometrial cancers, are a different cell type than everything in black. But notice that the things in black, endocervical, ectocervical, vaginal, and vulvar, are all black. They all have the same etiology, exposure to HPV, and they all develop the same malignancy, squamous cell carcinoma. So we use this process of developing cancer, exposure by age, and then also the type of cancer to finally build our summative table, which you should take with you on each subsequent lecture as you study gyn cancers. We're going to break this down according to the cancer it is, the etiology, or the risk factor, what pre-cancer looks like, what the cancer looks like, if there is a screen or not, and then anything in the patient history or the vignette you'll see that will help tip you off. First, we're going to talk about cervical, vaginal, and vulvar. The etiology of all 3 is HPV. And since this will progress to squamous cell carcinoma, they have the same precancer, which is carcinoma in situ. You don't screen for vaginal or vulvar cancers, even though it has the same etiology and becomes the same cancer as cervical. But you do screen for cervical cancer with a pap smear. If they have full-blown cancer, what you can expect to see for cervical cancer is postcoital bleeding, where vaginal and vulvar cancers will be black lesions that are also pruritic, black and itchy. Endometrial cancers are caused by exposure to estrogen. The precancer, since there is no screen for this, generally isn't identified, but you'll get some form of dysplasia or atypia as it progresses to adenocarcinoma. Suspect endometrial cancer when you have a postmenopausal bleeder. Now we said that ovarian cancer has multiple subtypes. The one that I'm going to talk about here, and the one we spend the most time on in that lecture, is the epithelial ovarian cancer, the one that presents later in life and has a high mortality. The etiology is ovulation, trauma to the epithelial layer. The precancer you're not going to see. It's called low malignant potential, but you never biopsy the ovary, essentially, and you cannot screen for this. You can only get epithelial ovarian cancer when you finally see it. So very rarely will you identify the precancer of ovarian. And the patient is going to present with very late-stage symptoms of a cancer that's spread. Look for renal failure from obstructive hydroureter, small bowel obstruction, or ascites. And lastly is gestational trophoblastic disease, choriocarcinoma. The etiology of choriocarcinoma generally comes from gestational trophoblastic disease. And gestational trophoblastic disease is effectively the precancer. That means incomplete mole, or even a normal pregnancy. The cancer that forms is chorio. And while we don't have any screening necessarily, what we do is we follow beta-HCG while the person is on OCPs. The idea is if the beta-HCG rises while on contraception, it must be because the cancer is coming back. And the patient is going to present with symptoms of elevated beta-HCG, which is going to be things like hyperemesis gravidarum, hyperthyroid, and size dates discrepancies. So what we did here is give you a preview for gynecologic cancers. Etiology to cancer, risk factor by age group, organs that can be involved, and a summary table to take with you in the next couple of lectures. We cover benign breast disease and breast cancer in the general surgery videos, which you can also watch if you're preparing for your gyne shelf. That is Introduction to Gynecologic Cancers.